Okay, so anyone who's been through it will tell you it's rough picking a nursing home. I mean, it's just one of those things loaded with worry. And for good reason, right? It's about finding the best possible care for someone. And that matters. Today's deep dive, well, we're tackling exactly that. How to make those nursing home tours more than just, looking at the furniture. We'll get into the questions that get you real answers so you can make a solid choice. Yeah, by the time we're done here, you'll feel way more equipped to really be an advocate for your loved one.
Yeah, you hit the nail on the head. Those tours, they can be kind of deceptive, right? They show you the shiny, happy facade. But what's daily life really like? What we're going to do is help you ask those pointed questions that get past the staged presentation and reveal what's actually going on in terms of care.
Now, I was going through the research material we've got, and one thing kept popping up. Staff ratios. Yeah, why is that so huge in the whole nursing home picture?
Okay, imagine this. Every single thing, medication, meals, just someone to talk to, it all depends on having enough staff. See, a place with low staff ratios, huge red flag. I remember this one facility, the staff were just swamped. Couldn't answer call buttons fast enough. Residents waiting for help with basic stuff like going to the bathroom. It was rough, man. It really just showed me how crucial enough staff is.
Makes you think, huh? It's not just about a place looking nice, but if it actually runs right. Right, okay. Let's say I'm on this tour. What are some real specific questions I should be asking about the staff?
Be direct, don't be shy. How many nurses to residents does that change on different shifts? What happens if there's an emergency? How long till a nurse can get there? Answers to these will tell you a lot about the level of care they can actually give.
Yeah, and all of that ties into resident well-being, right? Yeah. Another biggie the material highlighted was medication management. I mean, it seems kind of obvious, but I know it's a huge stress point.
It's a big deal. Even good places have slip-ups sometimes. But you want systems in place to keep those to a minimum, right? Ask about their medication procedures, how they keep track, check the dosages, all that. Are medications locked up tight? What happens when mistakes are made? The more you know, the better you feel about things, Makes sense.
Now, I know lots of folks in this situation, they're wearing multiple hats, family caregiver, maybe even work in healthcare themselves. Does all this advice still apply to them?
100%. Honestly, it's even more important for them if you've got that healthcare background. Yeah, you might spot things others miss, but asking questions, getting the specifics, that's how you advocate best for your loved one. Got to get all the info to make the right call.
So it sounds like we're saying, hey, don't just go on these tours to admire the wallpaper. You're on a fact-finding mission.
You got it. One last thing to keep in mind. Don't be scared to ask the tough questions, even if they feel kind of negative. Like, is staff turnover high? What are the biggest problems this place has to deal with? Might be uncomfortable, sure. But those answers, those are insightful. Like peeling back the layers to see the real everyday life there. Knowledge is power. And in this case, it's peace of mind.
Okay, so anyone who's been through